In the next few videos on the hidden behaviors of loneliness and what we can do about them, we're going to focus on the metrics you care about. KPIs like length of stay, appointment and medication adherence, program participation. Let's start with one of the big ones, medication adherence. We all know the stat. Almost half of patients with chronic conditions don't take their meds as prescribed. But what's often overlooked? Persistent loneliness might be the most under-recognized reason. Studies have shown that lonely or socially isolated individuals are significantly less likely to follow medical advice, even when they have access, understanding, and reminders. It's not forgetfulness, it's not noncompliance, it's biology, and it's behavior shaped by connection. Because here's what's happening when loneliness becomes chronic. The threat detection system in the brain gets switched on and stays on, and the reward system goes quiet. Motivation changes biologically and ultimately behaviorally. That's why a patient may say yes on the phone, but never fill the script, and why a friendly reminder might come off as judgment or pressure. To be clear, it's not about what you're doing. It's about how the lonely brain interprets what you're doing through a lens of fear, mistrust, and self-protection. So how do you help a potentially lonely person move from non-adherence to adherence? Well, at Clutch, we try and understand what drives behavior and support on what might return a person to connection. For example, one tool is motivation analysis, not just in isolation, but as shifting combination. When someone is lonely, their dominant motivators often get distorted. A need for approval might turn into fear of being judged. A desire for independence might harden into distrust. And a preference for peace might become avoidance of all connection. We use short, natural conversations, often from existing workflows, to assess each person's behavioral and motivational profile and provide personalized decision support based on what we learn. From those results, you can create personas that help your team tailor communication and program design. It's not about putting people in boxes. It's about improving outcomes by choosing what's most likely to work for that person. And when you understand how loneliness shifts motivation, you can make small changes to outreach and scripting that drive meaningful results. At Clutch, we help your teams understand what is driving non-adherence with science-based tools that give you the why behind the behavior and suggestions to improve connection and engagement. The result is improved adherence. If that matters to your bottom line, reach out. Let's talk. Thank you.